We're here to talk about being prepared should the community receive a patient who has Ebola.
The Cascade City County Health Department put together this meeting for people who may come in contact with someone who has the virus.
We really want to make sure everybody is getting the information and the facts.
Health Officer Tanya Houston spoke about a few of the myths she's heard about with the virus. One of the most talked about myths is how people can get infected.
One of those being that Ebola is airborne.
Health officials assure it is not airborne. Ebola, rather, is a blood-borne pathogen.
It's spread from person to person through direct contact with blood or other infectious body fluids like vomit or diarrhea.
Webb says that learning how to protect yourself from exposure is standard education in the healthcare field.
The Ebola situation has raised our awareness in that we are able to re-review our standard operating procedures and how we take care of patients. To me, it's no different than having a patient that has hepatitis C or HIV or hepatitis B.
If someone starts to show symptoms of being sick, there are two main questions to ask to make sure if it is Ebola or not.
One of those is the symptoms, such as fever, vomiting, diarrhea, etc., as well as the travel history.
If a person has not traveled or has not come into contact with bodily fluids, then that person does not have Ebola. It could, however, be influenza.
Generally, viral infections start out the same. There's maybe a low-grade fever, you have muscle aches, you feel like you've been hit by a Mack truck.
The standards we've heard time and time again continue to be the gold standard for staying healthy.
So really the take-home message is wash your hands, cover your cough, stay home if you're sick, and right now get your flu shot because it is flu season.
In Great Falls, Margaret DeMarco, NTN News.